Hello. Today we're going to be answering a big question. Do you have PCOS? A lot of women come to my practice and they have this question. They seem to have a lot of symptoms associated with PCOS, but they're not sure if they have it or not. Today I'm going to make it really simple for you to determine whether or not you should see your doctor to find out for once and for all if you have PCOS. When we're diagnosing PCOS, we use what's known as the Rotterdam Criteria. This was established in about 2003 and gives us 3 different criteria for determining whether or not a woman has PCOS. The first criteria is whether or not a woman has infrequent or no ovulation. How we know this is whether or not a woman has regular or irregular cycles. If you have irregular cycles, or maybe no cycles at all, meaning you don't have periods, that means it's likely that you're not ovulating and you have one of these criteria. Criteria number 2 is that you have signs and symptoms or even laboratory testing that shows that you have high androgen levels. Androgens are our testosterone family, and the symptoms that can be associated with high androgen levels are things like acne, especially on the beard distribution of your face, on your chest or your back. Other signs of androgen dominance or high levels of testosterone are things like hair loss, facial hair growth, so mustache, chin, neck, or darkening of your skin wherever there's a fold, like underneath your arms or under your breasts. The third criteria of the Rotterdam Criteria is having cysts on your ovaries during an ultrasound. Now, you only need 2 out of 3 criteria to have a diagnosis of PCOS. So a lot of women come to me and they say, look, I don't have regular periods. I've got this terrible hair growth on my chin. They're like this long before I find them. I know, ladies, it happens. It's startling. Or they have things like acne. And so we're able to, just in the course of a discussion, determine like it's likely that they have PCOS, but we never stop there. When a woman comes to me, we do a clinical evaluation. We talk through a lot of the different signs and symptoms that can be associated with PCOS, and then we do some laboratory investigation. When we're doing that first step of determining whether or not a woman has PCOS, there's a lot of different questions we want to ask. We want to understand how regular her periods are. Are they coming frequently? A period that comes less than every 35 days is considered to be within the range of normal. But if your periods come more than every 35 days, or you have a regular cycle 1 month and then you miss a cycle, so you have a 28-day and then maybe a 60-day cycle, you're probably not ovulating in that second cycle and you may be forming cysts during that time. The next thing we look at are those signs of high testosterone. Acne on the face, chest, or back. Hirsutism, which is the growth of hair in more of a male pattern. So again, beard, chin, neck, upper lip. Hair loss. High levels of testosterone are associated with hair loss in women, particularly in what's known as this U-shaped pattern, where they have hair thinning at the anterior hairline, along their part, or even at the tops of their heads. Women who have oily skin or oily hair could potentially have high levels of testosterone, which could be contributing to a diagnosis of PCOS. Sugar cravings are another one. This can be a sign of insulin imbalances, which is one of the major causes of PCOS. Other symptoms of insulin imbalances include things like dizziness or lightheadedness or feeling really hangry if you miss a meal. Another thing we often don't think about are things like recurrent yeast infections. This can be a sign of elevated blood sugar levels as well. So if you experience recurrent yeast infections vaginally or in your mouth or in your digestive tract, it's something else to consider. If you're overweight or have difficulty losing weight, this can be both a cause and a consequence of PCOS, but not every woman who has PCOS is overweight. So just because you have a normal body weight does not mean that you may not be developing PCOS. Infertility is another thing that people will note, that they might have difficulty getting pregnant. So that's something to take into consideration. And if you have a family history of PCOS, or if you have a family history of type 2 diabetes, these are other considerations that may lead you to getting the lab testing to confirm a diagnosis of PCOS. Lab testing is that big second criteria for PCOS, and it's an essential component of understanding whether or not you have it, but also how to treat it. If you're taking the birth control pill to suppress your PCOS symptoms, the lab testing that we can do won't give us accurate information. So if you're currently taking the pill as a way of suppressing your PCOS and you really want to get to what's causing the PCOS, then you'd need to come off of the pill for at least 2 to 3 months before doing the testing to get an accurate diagnosis. When we do testing for PCOS, we often do comprehensive hormonal testing. We test hormones from your pituitary, like luteinizing hormone and follicle stimulating hormone, as well as hormones from your ovaries, like testosterone, estrogen, and progesterone. We also will test other hormones, like your insulin levels and your fasting blood sugar levels, in order to determine what could potentially be contributing to your PCOS so that we know how to treat it. So, if you're concerned that you may have PCOS, ask yourself some of these questions. Really understand whether or not you feel like you meet the criteria for PCOS. And if you do, see your naturopathic doctor, your functional medicine doctor, or your conventional medicine doctor to get some comprehensive hormone testing now. There's so much that we can do to overcome the hormonal imbalance of PCOS, and it's easier the sooner you start. All right. As always, if you have any questions, don't hesitate to get in touch with me. Join me on my Facebook page, follow me on Instagram, subscribe below, like this video, do anything to connect with me because I would love to connect with you. Take good care.